Okay, I think we'll get started now. It's good to see people back again for our fourth and final program in this series. As always, it's been a pleasure to learn and teach with Torah Motion. Since there are many Canadians in the group here, and I think people, particularly from Toronto, I just want to mention that next Shabbat, Emir Hashem, I'll be in Toronto. I'll be at the Bayit over Shabbat, and at Sharei Shemayim, we have a special health and social services fair on Sunday morning. Hope you've been seeing this around. And please, I'll be at the Bayit as well over Shabbat. And Saturday night and Sunday morning, we'll be doing something about advanced healthcare directives. But you also see that there's a whole slew of other chesed, health and social services organizations that will have booths and will be presenting there, and but also be doing explanation of our advanced healthcare directive, and Shabbos, like I said, in the Bay up further north. Once again, Saturday night with the healthcare directive as well. So if you're around, I'd love to see you. Love to meet you in person, and looking forward to that. Okay, so this week, please God, we're going to be speaking now about the issue of dealing with situations which can be multifaceted in a lot of different ways. And when a person feels that their loved one or a patient, discuss both cases, is doing something which goes against their ethical conscience or goes against their view of halacha, and how to deal with such a scenario. This is a sensitive matter because obviously many of us, we live in a diverse world, a pluralistic world, and many of us have diverse families in one form or another. And so this issue can come up in a lot of different ways. And therefore, it pays for us, I think, to think about sort of dealing with this issue. The other day, someone was telling me, very committed Orthodox family, a woman was telling me how her grandfather was cremated. That was his decision. It wasn't particularly, I guess, observant, certainly affiliated, but not observant. And at many levels, this was a source of pain to the family of the decision that was made. I think those of you that are Americans know that amongst American Jews, cremation has increased dramatically, along as with a broader population. My understanding is that in Canada, it's not quite the same. Canadian Jews a little more traditional in a lot of different ways, but that's certainly a phenomenon, and it's one of those examples where it causes a tremendous amount of pain to families. Now, when it comes to those situations, so actually in that situation, when it comes to cremation, the Shulchan Aruch brings down la halacha and says, a person says, I don't want to be buried, we don't listen to them. Right? Ein shomim lo. Right? This is a mafurish teaching of Shulchan Aruch, but nonetheless, it's obviously a lot harder in practice in terms of dealing with these things, because people have their autonomy and have their choices that they've made. And so, it runs into a lot of different broader issues when we get in, obviously, in a personal dynamic. And the same is true with regard to dealing with end-of-life care decision-making. So here we run into a few different issues. Issue number one relates to when you, as a loved one, disagree with the position that was taken by someone else. Now, of course, you can disagree on a medical level, but that's a type of decision where that's not per se. You might say, oh, they should have done X, Y, or Z, or they should go on to this doctor, that doctor. But once again, here, a lot of this is a matter of personal choice, meaning one of the things we have to respect is that people have to make their own decisions when it comes to healthcare matters. And by and large, broadly speaking, within a certain range of, this is probably where we get to right now, those decisions should be respected. This is why I think I stressed previously the importance of people clarifying their own preferences and their own values when it comes to this issue during their lifetime, and establishing who should be making decisions on their behalf, and if necessary, if so inclined, also who a person should be consulting with on a rabbinic level, because that is one of the great decisions that people get to make in life. You choose how you want to, how your sort of vision of Judaism and halacha and who your posek is and your rabbi is, and that's why it's so central to do that. I don't know if I mentioned in the course in this class. I think I might have, but I want to highlight something that came up in Amatai's consultation work not that long ago, where someone, I think I might mention this case, but I want to highlight in this context, where someone called me. They have 4 or 5, I think they have 5 children, and it was one of the siblings that called me, one of the children, and it had to do with the case we were dealing with last week, right? Talking a lot about, or 2 weeks ago, excuse me, with regard to dementia. And um, 3 of the children were more similar religiously, meaning they're more like Haredi, ultra-Orthodox, if you will. And one of the siblings who would call me was more religious Zionist, mono-Orthodox, whatever, and one was less observant. And when you have those situations, so you need to decide to make a statement. Who is going to make decisions on your behalf? And the mother or the father in this case had made such a decision. And that was a hard thing for the Haredi siblings to swallow, but they accepted it because they understood their mom was, or father was a little bit different than them. And they accepted the fact that that was their legitimate choice to make. And it really had a nafkamina, it really had a real ramification, because I think if the siblings, 3 of the siblings had their way, they would have been able to, they would have done, made different decisions than was made by the sibling who was put in charge and was consulted with me and others on this matter. And so here, I think we need to make a real distinction between 2 different types of cases. Case number 1 has to do with a situation where you have one view, but the person, the family member, has decided to take another view, which is perfectly legitimate within the halachic realm, but is not something you would believe in, not something you would support, and not something, if you were asking the question or if you were making those decisions, you would do. So here, I think it's very important to recognize that that we have to be respectful of people, of the decisions they make, the psakim they get, the decisions that they go with, and recognize the fact that there's a wide range of opinions. I mean, we've seen even the past few weeks some very, very significant differences of opinion on really big matters. So we spoke about organ donation. I can't tell you how many times this comes up. There'll be a situation where one family member, certain family members will say, we accept respiratory brain death. We want to donate loved one's organs. And there's one member of the family who insists that this is wrong, or this is murder, or they heard this or that, and is trying to, sort of make a big protest, a mocha, if you will, against that decision. And with all due respect, I've had to have this conversation before. With all due respect, right? Why are you who put you in charge, right? Who made you make that decision? Why is it that, don't we believe in Elu Ve'elu at a certain point, right? This was a decision. And that's a major issue which comes up in many, many different areas. So when it comes to the question of withholding interventions with dementias, we spoke about a couple of weeks ago, right? Not last week, but 2 weeks ago. So once again, this is a big issue of debate within halachic circles. And given that fact, people should be respectful when you have a bona fide positions, that this should be respected if that was the wishes, particularly of the person, the patient, or the person they put in charge of making those decisions. Now, this sounds trivial in some respects, but it's really not trivial. It happens all the time in many family dynamics, and where people are upset because they would have done X and someone else decided Y. And sometimes that's a very, very difficult thing to accept, but it's important to recognize the same way that someone can decide, I want to wear tchelet to my talis and not wear tchelet to my talis, or people want to do a different minhag in one way or another. So too, people have the right. Obviously, this is a little bit of a weightier matter, but people have the right to make that decision. And so that's why I stress to people, when you're thinking about these issues, to clarify who should be making these decisions, who should be consulted, and to let the family members know who you want to do this. Because even though what I said right now, I think is trivial in many ways, right? In other words, but other people, I think many people agree with that intuitively. But when push comes to shove, people don't accept that position. I think the organ donation case is a perfect example of it, because we understand there's a lot at stake here. It's a weighty topic, but we should respect it. There's a very high profile case about 15 years ago in Israel. I think it's the only case like this, actually, where the deceased was a famous Israeli soccer player, football, but real football, which you actually play with your feet, right? So a football player, a soccer player, and he died in a motorcycle accident. And he had signed a Kartis Adi, right, the organ donation card in Israel, and which is a legally binding thing. And the family had agreed, right, to follow along with it. In theory, it's legally binding, but the family put up a real protest. It'll be difficult to implement, but the family agreed. They had called in already the potential recipients to come to the hospital, right, because they're prepping the player for, right, who's now been declared dead, for transfers, for transplantation or for surgical retrieval of organs. And then an old teammate of his who had been choser b'tshuva and become Haredi came and told them they're doing this terrible thing and you're killing him and whatnot. And the last minute, the family canceled it. Okay, so let's put it mildly. I mean, this was a terrible thing. First of all, the family was going against the express wishes of the person who signed the Kartis Adi. People have been called to the hospital already, and who's this guy to say, right? The position which has been supported by the Rabbi Rashid and others. So just highlighting that phenomenon where it's so important to have a little bit of a recognition here of that there is a variety of perspectives on these things, and people should be respectful for it. Now, where it gets tricky, and really tricky, is when the options that people are choosing to take are explicitly against halakha, right? Where they're explicitly not in consonance with any legitimate or accepted position. Now, admittedly, it's not always clear what's the legitimate position, what's the accepted position, right? You can have cases where, I remember, I won't get into the issue right now because I won't get caught up with it, but I was speaking to a certain posek about the issue of healthcare providers who are asked to do a certain procedure, which many poskim think is usher, but some, few minority feel is mutter. And this posek said to me, who says it's mutter at all, right? It's not, and I mentioned some names, like their opinions don't count, right? In other words, I'm not getting into the particular issue because I don't want to get caught up with it, but it raises a little bit of a larger issue at stake. But there are certain cases, particularly today, where the options at hand are clearly, I think, against halachic, beyond the halachic pale. And the issue I want to speak about, this comes up in different places, but the issue that I particularly want to speak about is medical assistance in dying, MAID, or what used to be called euthanasia or physician-assisted suicide. Euthanasia and physician-assisted suicide, not the same thing, but they've been sort of covered, encompassed into this term called medical assistance in dying, MAID. And this is a growing phenomenon in the States, for those of you from the States. So not euthanasia, but physician-assisted suicide is legal in 10 states as well as in Washington, D.C. And there's talk as well of having so-called tourism physician-assisted suicide, meaning that you don't have to be resident of the state to have access to it. I think that's already being moved along. But in Canada, for you Canadians, as hopefully you're aware of the fact, euthanasia, MAID, right, including primarily it's being used as euthanasia, has been legalized since 2016. And not only has it been legalized, but it's being used quite often. So they just released, I think 2 weeks ago, the stats for 2022, and take a look. 13,241 people elected to die through hands of the doctors, if you will, through MAID in 2022. It's about 4.1% of all deaths in Canada now happen through medical assistance in dying. And as you can see, the numbers are jumping every year. So it seems about the numbers have jumped about 31%, somewhat consistently over the course of years. Particularly interesting now, because of this is a change in the law, is the fact that 3.5%, let me see if I can show this to you better here, but 3.5% of the cases are not cases where there's terminal illness. It's a case of terminal illness, what not being a case of terminal illness, meaning not being a case where the death of the patient has been prognosed within, let's say, 6 months or so. Meaning someone has some form of suffering and whatnot, but they're not in a case where we call terminal illness, and yet they're being allowed, as you can see in the last couple of years, to utilize medical assistance in dying, and that includes 3.5% of the cases. So this is a growing phenomenon. It's a phenomenon which, as you can see, life has, the law has changed considerably over the past couple of years. The key, this is what I tried to show you beforehand, is that in 2021, they've allowed MAID even in cases when death is not reasonably foreseeable. And in 2023, March 2023, several months ago, it was supposed to be that mental illness alone as a sole underlying medical condition was enough of a reason to be able to get MAID. There was a lot of pushback on this, and that's been delayed till March 2024. There is a bit of a discussion whether or not that law is going to be implemented then. It looks like right now it will be implemented because various legislative attempts have failed to stop it being expanded. But to understand what we're talking about, this means if a person says the only issue, I'm not trying to belittle it, but the only issue is I have a case of irretractable mental suffering, that alone is a sufficient reason to be given MAID. And given the Canadian healthcare system, where MAID can be sometimes much more accessible than mental health treatment, mental health access, we're talking about a alarming situation in my mind. And so one of the questions that comes up is sort of twofold. Question number one is, and you know, if you think this isn't impacting the Jewish community, you're not aware of what's going on, because there are clearly many cases of Jews who are electing to utilize MAID, including, by the way, quite traditional Jews. So I've had a meeting this week with some of the heads of the Rabbinic Association of Toronto, of CORE, and I've had meetings with colleagues in Montreal, where particularly people, let's say they're more traditional, sort of strongly affiliated. The show they don't go to that often is Orthodox and whatnot. So there are a lot of people like that in Canada, and who are committed, affiliated Jews in a lot of different ways, and who are utilizing MAID. There's no question about it, right? That they're utilizing it, and this is an area of great concern. And so you have two different elements here of A, how to deal with it when you have a family member, right, where this is coming about, and B, what to do about it in a situation of a healthcare professional. Now, you understand why these are different situations. When you're a family member, obviously, first and foremost, you want to show sympathy, empathy, and care for your loved one who's feeling this way. And I was speaking actually with yesterday with a leading critical care specialist in Toronto, who's been very, very active in this issue. Not Jewish, she's a very committed Catholic. And one of the things, she was saying to me, and something we have studies to show this, is that particularly in people in situations of critical care, of extended health situations, there's a lot of despair, particularly at the beginning. And part of the process is to try to give people amount of strength to find the proper medications, palliative care, and whatnot, to get them back to where they feel they have a very reasonable quality of life. And experience shows that can happen over time. It takes time. But to get to that point, And one of the things that she's particularly scared about is the situation where many people, particularly those with weaker social networks, weaker socioeconomic backgrounds, and whatnot, or more vulnerable in a lot of different ways, will elect, right, to go for MAID, which is much more easily accessible than some of the long-term care that's necessary in order to make it possible. And what she said to me, I think it resonated greatly with me, is the importance of support networks to make sure that we're trying to give that optimism, of that sense of positivity, which isn't, being sugarcoating the situation, but is trying to help them and find them the appropriate resources in order to reduce pain and suffering and restore senses of quality of life. Because again, in a situation when you have, in a situation when you have such easy access, and when the law is so liberal, if you will, right, in terms of who can be administered MAID. So you're going to have a lot of situations where people are going to be access to this without trying the methods that might be available to them. Okay? And so on that level, it is certainly very, very important for people. Now, there is a big issue which comes up, which is that, as generally speaking, suicide has been seen as a sin for which people are buried in a different area of the cemetery. And so, of course, people are buried. We always bury people. But traditionally, previous generations, when we understood less about mental health issues, so suicide, people died of death by suicide, we buried in a different part of the cemetery. And you can see this, by the way, in some older cemeteries where you'll see like a grave outside of the fence of the cemetery. And that can be for a few different reasons, but one of the reasons would certainly be a case of suicide. And the question becomes, in these scenarios of physician-assisted suicide, euthanasia, what should be done here? This is a very tragic situation. And my impression is that Lamaaseh, we are burying people in the regular spots, as we have done in the past for suicide cases, meaning more recent generations for suicide cases. But it just highlights the phenomenon of trying to do what we can in order to give support to get people, because as opposed to situations where there's legitimate machlokot and we should be respectful of people's decisions, this is a situation where we should show a lot of sympathy and empathy, but I think actively should try to get people not to elect to take this path. By the way, if there are any New Yorkers in the room on the Zoom, so New York State keeps on up and down bringing up issues of physician-assisted suicide. It's sort of like, well, if in New Jersey they're doing it, how come we're not doing it in New York? There's political pressure in both different ways. I'm actually testifying next week to a Bar Association committee on this matter because, like I said, there's a trend in a lot of different states in this direction. And as I've tried to tell my colleagues in a lot of different places, Jews should be aware of what's going on these issues because it's going to impact the culture of healthcare in those places and the way we look about life and death. And it's very important for Jews to have making statements on this issue. Now, besides that broader issue, a massive issue, which I want to focus now for the rest of this year, has to do with healthcare providers who are working in places, whether they're working with Jews or non-Jews, where this is available. And the question becomes is, what are you allowed to do to participate, to be involved, or if you will, as a healthcare provider when your patient has made this decision? This is a matter of great concern right now amongst Jews, Jewish healthcare providers in places like California, in places like New Jersey, and particularly in Canada. I cannot tell you how many people are really concerned about this right now, because in the Canadian case is very significant because in Canada, there's a mandate of what's known as effective referral. What that means is that all healthcare providers are obligated, when asked by a patient regarding MAID, they don't have to encourage them to do it, or they don't have to, certainly not to participate in medical assistance in dying, but they have to give an effective referral, which means that they have to reasonably give people the information about how to access MAID in an effective way. Okay, and this is causing a lot of nervousness. It's, by the way, and it's not just a religious thing per se. So in Canada today, you'll see a lot of both liberals and conservatives, so both the left and the right, who are concerned with this phenomenon, because there are many people. I'll try to pull up the screen here. There are many people who, not only from the conservative right, but also on the left, who are very concerned that basically the MAID law is just taking advantage of people who are vulnerable and a violation of human rights. So if you look on the left column here, amongst those critics are 3 United Nations disability and human rights experts who sent a letter to the Canadian government that legalizing assisted suicide for disabled people who are not terminally ill, the law as written has devalued their lives by suggesting that significant disability can be worse than death. Okay, and so this isn't just a right-wing thing per se, but you have this phenomenon on the left as well, which is it's a good thing for the opposition to this phenomenon, because it's always better if you can build big tent opposition for people coming from different ways. Big tent coalitions tend, in general, to be stronger. Although in the case in Canada, what's happened really is that despite the concern being raised by human rights advocates and others, there's a lot of pressure on the Liberal political party to support this. And so even when MPs don't want to support it, they'll abstain in votes. And that's part of the phenomenon. But it's important to understand that this isn't just a religious thing. And this is something that people of conscience don't think that this is what their view of medicine should be like. But it's interesting, they just did a poll of Canadians. 70% of Canadians feel that it's very important that religious doctors, even if it goes against their religious conscience, right? Even if it goes against the religious conscience, must give an effective referral. Okay? In other words, Canadians understand that they don't want doctors to have to be involved per se in something to go against their conscience, but they feel very strongly that the doctors have to give them access to the treatment, even go against the doctor's significant view of what's right and wrong. So this is causing a lot of consternation, particularly if the mental health element enters into law in March 2024. Because imagine a situation, I see a couple of comments, I'll come to momentarily. Imagine a situation, you're a psychiatrist, you're seeing a patient, and you feel very strongly that this patient can get through, right, their situation through care, right? It's going to be long-term, it might be long-term process, but through medicine, through treatment, for interventions, from all sorts of different types of support networks, people can get through it. And then the patient says to you, like, listen, I'm suffering. I just want to figure out how to use this MAID thing. What are you supposed to do? So by law, when they say that to you, you're required, and again, we're balancing rights. Someone was putting into the comments here, right? But by law, you're required to give them an effective referral, let them know where they can do that. And for many healthcare professionals, this goes against what they think is the Hippocratic Code, and this goes against do not harm, and they just think it goes against good healthcare. Okay, so this is causing really, just a massive amount of concern in the community, and therefore it's important to understand a little bit of the aspects here. So again, we're going to focus on this issue. This could come up in other areas of medical treatment as well, but our focus right now is going to be on this issue. And let's establish from the get-go, when the Torah tells us, edrosh, by Parshat Noach, Perek Tet, Breshit, and it learns out from here, right? There's this understanding here of the reckoning of life, of bloodletting, which is very problematic. And the Gemara in Bava Kama, excuse me, Daf Tzadik Aleph, tells us that from here we learn this notion of saying you can't take your own blood, let alone the blood of others, and this means one is liable for taking their own life. And on this pasuk, there's a very, very interesting comment of Tzvi Mecklenburg, the Baal Haktav HaKabbalah, early 19th century Germany, who notes the following. I mean, it's a really wild statement in a lot of different ways, and says as follows: listen, killing can go in two different types. You can have l'rata nirtzach, and you get the tovata nirtzach, right? You can do it where you're causing it, your intentions are evil, or put it for the bad of the victim, right? That you want to have vengeance against them, or you want to take their life, or take something from them, right? That's one type of killing someone. And then he says, well, listen, there's also another type of killing. This is l'tovat hanirtzach. When you have a situation where a person is suffering greatly and they would choose death. And he brings a couple of cases like this where we see such sentiments in Tanakh. And the K'tava Kabbalah says the prohibition of killing applies to both. Al shnei ele diber hakatuv, right? It says on both. Even though you do it because you love the person, and letovato, nonetheless, this is considered to be shvichot damim. As he ends, v'yazhir ben l'shovach dam ha'adam l'snato ben lahavato. The prohibition of killing someone applies whether you're doing it out of love or whether you are doing it out of hate. Okay, so it's important to establish this. It's important to establish this from the get-go, that this seems to be a pretty bona fide isur. And then the question becomes is, well, if a person is asking if you do this nonetheless, what is allowed? Now, I don't want to get caught up here. I think this is what I've said to you right now is very well established. I am very well aware of the fact that throughout Jewish history, you've had cases of suicides, people choosing suicide over martyrdom, right? We talked about this a lot on the Tisha B'Av, and you have cases from the Crusades, and you have the 400 children in the times of Chazal, and you have Hananiah ben Atradion, which has a sort of ambiguous ending to the story. I understand that this is true, and I think what all of these stories highlight for us, though, leaving aside the difficulties of how to interpret them, is there's one thing on a ad hoc level, on exceptional cases and whatnot, to justify behavior, excuse certain behavior, and to explain it. Because again, we have sympathy for suffering and pain. There's another thing to say ab initio, right? Lechatchila, this is mutar, and therefore I think it's important to understand that, along with the following, and this is huge, and this is one of the things I keep on trying to mention to my rabbinic colleagues in different places. It's not sufficient to say gewalt. It's not sufficient to say usser. When it comes to euthanasia, it's important to also be arguing that we have an alternative. And the alternative is a real stress and promotion of the notions of palliative care. Palliative care, when I mean that, of course, I'm referring to treatments. Could be medical, could be emotional, a lot of the elements of palliative care, but elements which is not to be confused with hospice care. Hospice is the last 6 months of a person's life to sort of just focus interventions on pain and comfort, whereas palliative care can be from the very get-go, from a disease, can be from cancer treatment and whatnot. And as a general rule, palliative care has just meant that we're trying to do whatever we can to alleviate pain. And it could be that there are cases where, particularly towards the end of life, um, that this will be acceptable. Excuse me, towards the end of life, where there's sometimes a concern that palliative care, let's say morphine or whatnot, pain medication, will hasten someone's death. Although many palliative care specialists tell me, they're very emphatic on this point, that when done right, it does not, in fact, hasten someone's death. And this is certainly doable. But it could be that in some cases you'll depress breathing for whatnot. But the intention in these cases, of course, is to alleviate pain. It's not to hasten someone's death. And so while that's a subtle nuance, but I think it's a very, very, very important nuance to understand, right? And it's important to understand that intention here is key. And if you want to, I'm not getting into what palliative sedation is here per se, but the key point here is that the intent is to provide symptom relief, and it is not expressly to end the life of the patient. And there's an element of proportionality here where you're doing it just to deal with the symptoms. The criteria for success here is patient comfort. The criteria for success is not defined by the death of the patient, as opposed to in cases of euthanasia, where that is the case. And so it is important, it's very important to make such a distinction. And what happened in Canada, someone I think asked this, Len was asking about this, about litigation in Canada to rein in MAID. That's really complicated because the whole phenomenon of MAID was pushed alongside by the Canadian Supreme Court. This is a well-known case, Carter v. Canada in 2015, where the court found that the rights to liberty and security of the person, which deal with concerns about autonomy and quality of life, are also engaged, and an individual's response to a grievous and irremediable medical condition is a matter critical to their dignity and autonomy. And so in the name of liberty, in the name of dignity and autonomy, it was precisely the court that pushed along the legislature in order to legalize MAID. So it's not just a simple situation of a legal matter right now, because meaning of a legislative matter. It's a much broader question in terms of the culture of the society and how it views these issues. And so when autonomy is at stake and autonomy is being stressed, so one of the big questions becomes is, well, can doctors take part in this effective referral, right? Is this something, not just doctors, but it could be other healthcare professionals as well, nurses and others, right? Can they take part in this? Now, if they're actually being asked to administer medical assistance in dying, this would clearly be forbidden, because you are taking part, I don't want to call people murderers here, right? But you're taking part in the active, not only hastening of someone's death, but intentionally bringing their life to an end. But when it comes to effective referral, so here's what's required. The physician takes positive action to connect a patient with another physician, healthcare provider, or agency. Okay. Now, sometimes you'll have partners in a firm. This can be helpful. You can have other members of the staff and the hospital staff, whatever it is. But you understand that you're going to be doing a positive action, right, to help connect that patient. The effective referral must be made to a non-objecting physician, healthcare provider, or agency that's accessible and available to the patient. And the effective referral must be made in a timely manner, so the patient will not experience an adverse clinical outcome due to a delay in making the connection. That's a funny expression, adverse clinical outcome. I mean, adverse clinical outcome, right? The whole point of sending to the person is for the sake of giving them assistance in dying. And one of the objections that many doctors have in this situation is you are basically forcing the situation where you're not allowing a patient, right, to have time and to give us other treatments and whatnot. I mean, this is an area of great concern, because you could say, well, there should be a time limit. You should say, come back to me next week, right? There's maybe a lot of factors here. And part of what effective referral is demanding is that you do this in a timely manner. So this issue is somewhat unique, but it's not fully unique, right? This issue has come up in the past. And the parallel issue where this came up, where the psakim are quite significant, had to do with cases of abortion. It's not our topic today. Sometimes abortions are certainly listed under Jewish law, but there are certainly cases where you find, say, the Kol HaDei, according to all opinions, abortion would not be permissible in such a situation. And the question became is, well, first of all, it'd certainly be forbidden to be the doctor who is performing the abortion in this case. But what about those who are assisting, the anesthesiologist, the ultrasound technician? What about those situations? And particularly when a question came up is, would you have to give up your job? Meaning that might not be the type of job you want to take in the first place, but for the vast majority of cases, you really want to be an anesthesiologist. Vast majority of cases, this isn't the situation. Would you have to give up your job in this circumstance? And Rav Shlomo Zalman Auerbach and Rav Elyashiv felt that with an ultrasound technician, this would not be the case. And the reason that they argue that you not have to is because at best here, what you have a situation where you are somewhat aiding and abetting, right, to provide certain knowledge and information that be used in the case that would allow for the abortion to take place, but you're not there ototo, right? You're not there at the same time. You're not involved in it, the act at that moment, and therefore this would be mutter, right? Meaning it'd be mutter to not give up your job, certainly in this case. Right? Because as Rabbi Yashu says here, because there's no direct connection. Bozmani at that moment, right? As opposed to there's not a direct connection at that time between what a person would be doing, knowledge from the ultrasound and from the act of the abortion. Think about for a moment, it's always possible, right, that people would do the ultrasound, right, to get that information even, but then not actually go ahead with it. Whereas opposed to an anesthesiologist, Rav Shlomo Zalman wrote as follows: right? הנמצא שהמרדים הוא ממש שותף לאישה ורופא הרופאים להרוג נפש מישראל, שזה חמור מאוד. He feels that the anesthesiologist who's taking part in facilitating this, not just facilitating it, but being a part of the process, the active process, is an equal partner in this with the woman and the doctor, and this is usher to take part in, usher to the point where they felt a person would have to give up their job if they couldn't get out of doing such things. When it comes to, however, that was the position of Rav Shlomo Zalman and Rav Elyashiv, but this was not the position of the man on the left, Rav Eliezer Waldenberg, Tzitz Eliezer. And Rav Waldenberg wrote as follows on this issue. Excuse me, sorry, please. Rav Waldenberg, this is brought down in Nishmat Avraham, Sefer Nishmat Avraham, in the Hebrew version. Why do I stress this? Because it's a very interesting phenomenon that certain psakim are written in the Hebrew versions of various books and not in the English versions of various books. And the English version of Nishma Avraham, translated by, I think, Feldheim, there's a footnote. See what the Tzitz Eliezer told me in the Hebrew book. And I think actually, in this case, that was wise because what the Nishma Avraham doesn't want to have happen is people quoting Tzitz Eliezer to try to push Jewish healthcare professionals to do things which, whether or not it's mutter or usher, is something they don't want to do. So use this with caution, my friends. But in any case, the Tzitz Eliezer of Oldenburg said as follows: right? In other words, what he's saying is that the general principle, the general principle of Lifnei Iver is Lifnei Iver only applies when you are facilitating it. But if you're not facilitating it, because if they don't use you, they can use someone else, right? There's other anesthesiologists around. So that's not Lifnei Iver, right? And the second part, which comes is that you might say, okay, there's not isur of liftei iver, but there's an isur of what's known as misayeh. You might call it aiding and abetting, not facilitating, but aiding and abetting. And he says, listen, this is maybe a derabanan, but it is a derabanan which we don't impose upon people if it means they're going to lose their entire parnasa of a very, very significant medical phenomenon. And moreover, he says, listen, if you're dealing with, in particular, whether it's non-Jews or non-religious Jews, it's not clear that there's any isser of Messiah in general, and therefore Rav Waldman felt you couldn't do the abortion in this case, be the actual doctor, right? But being anesthesiologist, well, it's an uncomfortable situation, you wouldn't have to give up your job for that circumstance. And following those lines, there is a tshuva. It's not a secret, but it's not always well known. It appears in English, actually, in the book of one of his Talmidim, and this is a tshuva of Rav Asher Weiss, great posting in Yerushalayim today. And Rav Asher writes his tshuva, you see at the end, right? I'm very upset about this phenomena of suicide and of physician-assisted suicide and medical assistance in dying. And of course, if we could, we should just get rid of this law, right? But since we don't have control over this, I do think it is important for us to make sure, and it's very clear, his motivation here is that it's very important, it's a Jewish interest, a halachic interest, to make sure that we don't lose Jewish doctors, right? That we don't have a situation where people can't enter the field of medicine. And he gives two different arguments. Argument number one, which you saw already, is that this isn't lifnei iver because there are others readily accessible and around who will do this and will do the, remember, not doing the action, it's even referral. And this is also, he says, I don't even think this is Messiah because you're not even actually assisting the person, right? You're not even aiding and abetting the person who's doing the Maisa, right? You're not aiding and abetting the doctor who's doing me. All you're doing is a pniyah to those who then will send it on to others. And so, therefore, it's haloi bedat acherim. And therefore, he doesn't even think this is the din of Messiah. And given these circumstances, Rav Asher Weiss, despite the fact that he doesn't like the law one bit, says that effective referral is not a problem. I can tell you that in practice, there's a lot of differences of where this comes up in Canadian situations. It's a little bit easier for your general physician, your GP, and whatnot, because effective referral is not the same as direct referral. Effective referral, in these cases, you can do this, and this is one of the things we're working on in terms of recommendations to healthcare professionals there, is to give them to a general hotline that helps people with social care and medical care. And one of the options that they'll offer is made, but they'll also offer other options of palliative care and other types of treatments. And so if you're just giving an effective referral to that person, you could be sending, you don't know what it's going to end up being, right? It's totally without the cherem. In fact, it could end up being a situation where it goes to someone who's actually going to help them get proper care, right? So that's necessarily not a problem. It gets a little bit more complicated, not a little bit, actually a lot more complicated for some physicians in the hospital setting where, while technically it is effective referral, but it comes closer to direct referral because in some hospital situations, you're going to end up actually referring him to those who are in charge of administering MAID in that context. And that gets much more uncomfortable for people. Now, once again, according to Rav Asher, it's still not Misayeh even because it's totally B'dat Acherem, right? It's not just the fact that it's not concomitant. And understand that when you send people off, right, doesn't mean they're necessarily going to do. I mean, it's actually interesting. This has not been such the case in Canada, but in other places like in California where they've legalized physician-assisted suicide. So actually the majority of people, I don't know, majority, I think it's about half the people, even when they get from the physician the tools to commit suicide, they don't actually go through with it. And they do it because they want to have a sense of control. They want to have a sense of like a backup, comfort, whatever it is, right? So you understand that it's not a vadai that this is going to happen in those cases. And that's true here in these situations as well. And therefore, Rav Asher Weiss's opinion, I think, has a lot of logic to it to say that effective referral is not a violation per se, and therefore people should not be giving up their healthcare careers for it. And that's obviously a very important psak for a lot of different reasons, but you understand why many doctors who don't believe in this, right, are very troubled that this is not what they went into medicine for. And in this respect, I think it's important to keep in mind that there are certain reasons why we'd want and we think it's important for Jews to take a stand on these issues, right? And the sources I brought here actually have to do with the obligation of Jews to try to get non-Jews to keep the Shiva Mitzvahs B'nai Noach, the 7 Noahide laws. And seemingly, physician-assisted suicide, euthanasia, will be a violation of one of those laws of shvichut damim, right? And that being the case, I think some of these sources are quite relevant. And the sources give different arguments. It is true, by the way, that we don't see the vast majority of poskim don't think Jews are obligated to get non-Jews to keep the Shiva Mitzvahs B'nai Noach. The one exception to this rule was the Lubavitcher Rebbe Zatzal, who you can see why this is consistent with the general ethos, thought it was very important to try to spread Shiva Mitzvahs B'nai Noach to the non-Jewish world, and thought there's a certain element of an obligation for this. But other poskim don't feel this way, but nonetheless, they think it's important to promote certain values for a number of different reasons. So Sefer Hasidim in the 13th century says, just in general, we should note that Jews should see ourselves as obligated to try to make the world a better place. And the model for that is Yonah, right? Yonah is sent to Nineveh in order to get people to do tshuva, right? Right? This is a time when you got to get this appropriate to protest, right? So we have a model that if we want to get people to do better things and make the world a better place, just like Yonah did, we should be taking a stand. The Rambam has a little bit of a different formulation of this, where he says that's important to get people to have a system of law, and the rationale is clear. Right? So this should be a situation where we don't want to have a situation where others are doing things which is destructive to the world. And I think in this respect, it is important to note a very famous Mishnah, famous in the rabbinic sense, as we discussed last week, right? Where the Mishnah Avot tells us how great are human beings because they're created in the image of God. And here it's interesting that proof text comes from Breshit Tet, B'Tselem Elohim Asat Adam. Now you might say, why is the proof text coming from Breshit Tet? We know that human beings are created in the image of God early on in Breshit. And the Baal Tosfot Yom Tov Lippman Heller said as follows, even though there were other psukim that talk about human beings being created in the image of God, right, Perak Aleph of Breshit, first chapter of Breshit. But this pasuk in Perak Tet is talking about the context of the Shiva Mitzvahs B'nai Noach, that they're obligated. That we should stress that part of what we believe it is the human dignity, right, of all human beings, dignity of all human beings being created in the image of God. And we should believe in this idea of saying that there's a stress importance to keep the mitzvahs B'nai Noach in order to preserve human dignity in the world. And so this, I think, is another important value. And then finally, you have the argument of the Maram Shik in the 19th century, where he just says as follows. I think this is a really powerful and totally true observation, where he says, if you don't speak up against what's happening in the non-Jewish world, you're going to find yourself the next day where it's happening in the Jewish world. meaning there's no hermetic ceiling of what's going on in broader society that's going to impact our world as well. And that which is done befarhesia, yilamdu mimenu gam acherim v'yasu. And so therefore, there's a danger of not standing up against certain phenomenon when it will ultimately impact us as well. And so I do think this is an important issue that we should speak up about. And while it is true, Russia Weiss, as someone puts in the comments, followed by Rabbi Professor Adam Steinberg, have said to make the referral and keep your job. But I think they're both emphatic on this idea of saying that we should try to do what we can to overturn the expectation and try to get out of those situations as much as possible. And this is really an issue where we need to be aware of what's going on and find allies on this. And unfortunately, friends, I think in this issue, many times within the Jewish community, we're not going to be finding friends on this issue, and we're going to find in other faith communities like the Catholic community. So this is, I think, just an acute issue in this respect. I know that one of the reasons I was asked to speak to this New York board committee next week is that one of the other speakers is coming from a rabbi from the Reform movement, is coming out very much in favor of it because of autonomy and whatnot. And they felt it was important to have another Jewish voice who gave a different type of Jewish opinion on this. So I think it's gonna be like 2 or 3 in the morning where I am, but I'm getting up in order to make that point. And the same is true in Canada and other places as well, where you find that there are allies, not always in the Jewish community, but in other faith communities. But I do want to stress, and then I'll turn to questions, is that, like I said, this shouldn't be just a matter of the religious conservatives, so to speak, right? This is also a matter that can be and should be framed in terms of human rights and not taking advantage of the vulnerable, which is a real issue, which is why you do see people on both the conservative side of politics and on the progressive side of politics who are very, very concerned with this phenomenon. And we should be trying to amplify and broadening that tent on common issues. The same way you may have noticed, for those of you watching on the March on Washington yesterday, you had all sorts of people from all sorts of political backgrounds there, and that was, consciously done. I think that was wisely done, in my opinion. I don't want to get into Israeli politics right now. I have what to say about that as well. But I think that's a good strategy. And the same is true with regard to this issue as well. Okay, I'll open up. Let me see how I open up. If you can use your hand or raise your hand with questions or comments. Let me see if I can just unmute people or let people. Siri, go ahead.
Okay, if you want to respond to anything in the chat first, that's fine.
Go ahead while I start reading. It's hard to do.
Okay, so just 2 quick comments. One had to do with what you were saying at the very beginning about cremation, just at least in the greater New York area, but even nationally. There's a rabbi named Elchanan Zon who is expert at advising Chevra Kadisha members on all kinds of matters related to death and taharas. And he is particularly apoplectic when someone has requested cremation, and has been effective in meeting with the families and changing the minds of people occasionally. But he has reported success doing that. So if anybody ever happens to encounter that, I just wanted to put his name out there as an excellent resource, Elchanan Zon.
No, thank you. They have a whole website on this. I forget what it's called right now. I'm blanking on it, but you can certainly find it on the NASC website, the National Association of Chevra Kadisha. It is called End Cremation. I guess that wasn't the most. Well, they have 2 different sort of direct, but there are 2 different versions of it. So one is sort of like the appeal of the Orthodox community to get involved in this. And the second one is called Last Kindness, right, which is catered towards the non-Orthodox community and trying to sort of speak to them in this way. So I guess that's marketing as well. Everyone does their marketing, right? So lastkindness.org deals with this, and End Cremation deals with it from a different angle.
The other quick comment I wanted to make is that there's a parallel, though not in quite such a life and death situation, in American law in terms of people who wanted either contraception or the morning after pill, and a pharmacist for religious reasons would not want to dispense it. And I think the court held that if you can get it readily available at the pharmacy a mile away within a reasonable time and distance, he's not required to violate his religious principle. He or she, the pharmacist, not required to violate religious principles in order to prescribe it. So in a sense, it's effective referral in that
Right, right.
context.
So yeah, I think it's a great example, Suri, because it raises broader issues of how much we want to allow people's religious conscience in order to say I'm not going to be a part of certain things, even when it's a part of the standard piece of this. And this comes up in bakeries, right? It comes up
Yes.
famously, and it comes up in a lot of different scenarios. And so there's a lot at stake here. I think that's why it's important to, but you have to be consistent here, right? In other words, if you're going to insist that religious conscience to say that I don't have to be a part of X when someone else has a very different religious view, right? And they want to say, I don't want to be a part of this as well, to be sympathetic to it. Although I was showed something recently, I forget who showed it to me. I think is Rabbi Mordechai Torchiner, who showed me something from 1970 from the Association of Orthodox Jewish Scientists, a statement in which they make clear that healthcare professionals should do everything they can to avoid giving contraception to single women. Okay? So now that's an interesting case, right? It's an interesting parallel case. And you understand why, like today, I doubt too many people are worried about that for all sorts of reasons, actually, why this would be the case. And so, I think it's a good example to make us conscious of the fact that these things can shift in terms of the perception of it. Of course, there's different perspectives on contraception today than might have once been. But it's not unrelated, right? I mean, it's very much related in that circumstance in a lot of different ways. So thank you. That's a great example of it. Albert had a few comments here about the importance of standing up on this issue. And Quebec, yes. So Albert, you're correct. Quebec has a very, very strong drive towards MAID. And a disproportionate number of MAID cases are going on in Quebec. And that is going to impact. I mean, this has a little bit of an influence of the anti-religious sentiments they might see in France, and it's also in Quebec as well. But there are a number of different factors here that are going into place. And yeah, it's an area of real concern, because once this becomes sort of like the default recommendation, it's going to impact the types of healthcare that people have access to. I found, let me see if I can pull it up real fast, but there's a really wild statistic that came out, not from this year, but last year, and when they do statistics on Canadian attitudes towards MAID. And it's very interesting. The majority of Canadians continue to support MAID, although there's a lot of opposition, and there's a lot of opposition to the expansion of it. But they asked Canadians the following question. Agree or disagree? I'm worried that MAID will be a replacement for adequate social services in Canada. And as you can see, a strong, real clear majority, right, felt that they agree, that they are concerned that it's going to be a replacement for adequate social services in Canada. Now, this is really interesting to me because the numbers show that people are supportive of MAID, and yet they are really concerned about this phenomenon. And the more and more it spreads, I think it's going to be a greater fear that's going to impact. Obviously, another factor here at play here is money, right? It's a lot cheaper to allow a person. Again, by the way, I don't want to say it's only about money. Obviously, the doctors who support this, the healthcare professionals who support this, are supporting because they see people suffering and they want to alleviate people's suffering. Right? But the question is whether that's a legitimate means in terms of addressing this issue. And that's really a source of great concern. So, okay, thank you. Okay, if there are not any more questions, I'll wrap up the course in the series. And as always, I thank Torah Moshe, I thank all the wonderful participants that we have here. And please God, we'll have other occasions to learn together. Thank you, Naomi, for the kind words they put in the chat. And please God, for those of you again in Toronto, I hope to be there next Shabbat. Bayit and Shar Shemayim. I look forward to it. And we're talking with Torah Moshe now. You might have seen that my new sefer on Jewish military ethics is about to come out. Ethics of Our Fighters, it's called, from Maggid Books. Weirdly timed in a surreal manner that this is coming out, I have to say. It's painfully weirdly timed, but please God, I'll be out in the next month or so, and hopefully we'll have a Torah Motion series on that as well.
That would be
Stay tuned
great.
to your emails. Thank you.
Thank you so
Okay.
much, Rabbi.
Thank you, Sari. Thank you to everyone.
Thank you.